one of the things that this is kind of ambiguous at the moment, but what we're working on and it's going to happen this year is the Center for Medicare and Medicaid Innovation. I mean, I think everybody believes that we can do more to make Medicare better. It's about $40 billion of waste that occurs in Medicare every year. So we're trying to do two things. One is we're really trying to do something that we call creating a medical home. So that means that from now on you really get treated holistically instead of you see urologist here or a ears, nose, and throat person here, and that we really kind of create what's called a medical home, and that you're really treated holistically as a patient. We think that'll do two things. One, we think you'll have better health outcomes, and secondly, we think we'll drive down costs because you won't be getting some needless tests, and doctors will be speaking to each other and having partnerships with hospitals. So we really think this is going to be a way that we'll have better health outcomes and savings. We're putting a $10 billion investment over the next 10 years for the Center for Medicare and Medicaid Innovation. We've actually been holding listening sessions all across the country. Dr. Berwick and his staff have been coming all across the country. They had a listening session in Region 3, which is our region here. And so this was an opportunity for doctors, stakeholders, hospitals, et cetera, to give their feedback to us at HHS and tell us what they think the Center for Medicare and Medicaid Innovation should look like. Probably in March we'll start seeing the guidelines for this issued by Dr. Berwick at CMS. But again, it's really been done with lots of feedback and input from stakeholders. Finally, the Independent Payment Advisory Board, I mentioned that Medicare waste we're talking about. We're really trying to get rid of that. So, we've created this Independent Payment Advisory Board. This is a board that's going to have to make an annual report to Congress every year and really give us the recommendations on how we continue to eliminate waste and fraud in Medicare. Just this last year, we've actually seen about a 12% decrease in fraud, and that is really an issue that both Secretary Sebelius and Attorney General Holder care about. In fact, there's a fraud summit in Philadelphia on Wednesday where we'll both be there because they're really trying to get attention and a handle on this issue because, again, none of us want $40 billion of our taxpayers' money going to waste and fraud. So we're really taking a look at that. So that is it. That's kind of the overview. I wanted to show you these couple of websites which are really important. I gave some handouts that were on the table about immediate benefits to Virginia and information on the Affordable